Good morning, everybody. I'm Jackie Green from the Chatham County Council on Aging, and we are blessed to have Julie Jacobson Van with us from UNC. She's from the School of Nursing, and she is going to be doing our part 2 for preventive care based on evidence-based preventive care. So without further ado, I'm going to turn the spotlight over to Julie, and we are ready to go, Julie. Thank you for being here with us.
Well, thanks for inviting me. Hi, everybody. Thanks for being here. Jackie, hello? Jackie, you wanted me to share my screen, right?
Yep, that would be great.
Be able to share my screen. Okay, so I will get to my slides. I will see if the slideshow works. Okay, so perhaps about a month ago, I was on this program with one of my students, Anna, and Anna, and we did the first half of this presentation on prevention is key to great health. And we talked about the Medicare annual wellness visit and some evidence-based preventive services such as screenings. And so this is the second half of that presentation. I'm going to review a couple points from the first one, and then we'll get into some trivia. So I'll ask you questions about different preventive services.
Hey, Brum, come in here, man.
So again, I'm going to just reintroduce the Medicare annual wellness visit, talk briefly about the United States Preventive Services Task Force, talk about how they weigh risks and benefits, and then how they grade the services, and then we'll do some trivia.
Tell her come on in.
So just sorry for a little bit of review, the Medicare annual wellness visit is not like a regular physical exam. The first year you get onto Medicare, you have a welcome to Medicare visit, and then every year after that, you should have a Medicare annual wellness visit, which focuses on prevention. And your care provider, whether it's a physician or nurse practitioner, develops a plan with you for your shots or vaccinations, a screening schedule, and plans to be healthier, such as if you smoke to help you stop, or if you need to lose weight to work on plans. And you get various types of screenings like colonoscopies or blood pressure screening. The United States Preventive Services Task Force is the organization that helps determine what are the best screenings for people to get. And it's a volunteer panel of experts in various specialties like preventive medicine, nursing, and others. And they do these really extensive systematic scientific reviews, and they weigh the benefits and risks, because even with screenings, there are risks, and they decide and they make recommendations about what physicians and nurses should recommend to you for your screenings and preventive services. And it's important to point out, when we say screenings, it's not the same thing as diagnosing you with the disease. A screening is only for people who do not have symptoms of a disease or condition. And it's kind of like checking everybody to see who might have something. And they're usually not totally accurate. And then if you screen positive, you usually have to have some additional tests to see if you really have the problem. So screening is not the same thing as diagnosing, and it's only considered screening if you don't have symptoms. So if you have some sort of health problem, or you worry you have a health problem and you go in and get checked, that's not screening. So when we talk about these recommendations, it's not talking about whether or not you get checked if you're worried about a health problem. It's only if you feel healthy and don't have symptoms and you get these screenings. So the Preventive Services Task Force reviews scientific evidence, and then they give grades to each recommendation. A grade of A is the best, and doctors and nurses should offer this service to you. A grade of B is almost as good. The evidence is not as strong, but you should generally get that service if it's recommended as a B. A grade of C means that the benefits may not offer much above the risk. So generally, that's only going to be offered to certain people under certain circumstances if you have certain risk factors. And a D means you should not get that service, or your care provider shouldn't offer it to you because there are more harms than benefits. And a grade of I means they don't have enough evidence to know whether or not to offer it or not. So those are the grades for each of these preventive services. And when we say that they weigh the benefits and the risks, if you get screened and it actually helps to diagnose a health problem earlier, and if by treating earlier the outcomes are better, those are considered benefits. So if you get screened and there's no way of helping someone get better, then there's really not a benefit of screening. So there has to be some benefit, meaning by detecting something or finding something early, you're going to have a better outcome, better health, or longer life. But then the harms of screening, because screening tests are not completely accurate. Sometimes there are people that get a false positive result. Some people get a false negative result. If you get a positive result, but you really don't have the problem, it might mean that you get more tests, procedures, or even surgeries that are not necessary. And sometimes you can get harmed physically, psychologically, or both. So that's why when there are recommendations about whether or not to get screened, we look at the benefits in terms of whether or not there's an advantage to finding out early, and the harms in terms of whether or not you may end up having more tests and procedures than are necessary, and you might get harmed from that. Now, some people worry that, oh, these screening guidelines are just a ploy to save money, but that's not true, because the task force weighs risks and benefits, but they are not allowed to even consider the costs of screenings and services. So they're totally based on scientific evidence. Any questions so far, anyone? All right. Well, we are now going to get into the trivia questions. So I'm going to ask you some questions and then I'll give you the answers. So first one is, does the United States Preventive Services Task Force recommend that all adults get screened for, I'm going to move this, pre-diabetes and type 2 diabetes? Who says yes?
So does anyone think that all adults should get screened for pre-diabetes and type 2 diabetes?
No.
Yes.
Yes.
I say yes.
Yes.
I said no.
Yes.
No.
No.
Okay, so it sounds like we got quite the blend. All right, let's see who's right.
Okay, so we've got yeses and nos. The answer is no, and it's not all adults. So screening for pre-diabetes and type 2 diabetes is recommended for adults without symptoms who are aged 35 to 70 years of age, who are overweight or obese. So it's recommended, but only if people are overweight or obese based on the BMI or body mass index, because that's a big risk factor for diabetes.
So what does the screening for diabetes look like? Is that just the finger prick blood test?
That would be the blood test, and it might be because they're probably looking at, boy, I would have to look that one up. I know it's a blood test, and I'm not sure if it's a finger prick or if they're drawing blood from your arm.
So is that going by like an A1C, or would that be just the blood glucose level, the instantaneous one? Do you know?
I'd have to read the guidelines. Sorry, I don't, because I've never been screened, and I think it's Hemoglobin A1C measures long-term blood glucose,
Mm-hmm.
and a screening might end up being, but I'd have to look that up. A screening may end up being, just a simple glucose test with the finger prick. But even so, they'd probably have to do more than one. I'll have to look it up and I'll get back to you because I don't know.
I stumped the expert.
Yeah, it's like I know the recommendations, but I don't know how they do some of these. So, oops,
Gotcha.
that one I don't know.
You know
But
what?
here-
We're not supposed
but-
to know it all. That's all there is
That's
to
true.
it.
There's a lot to know. Okay, second one still is about screening for diabetes. So if a person is overweight or obese and between 35 and 70 years of age, how often should someone get screened for prediabetes and type 1 diabetes or type 2 diabetes? Would it be every 6 months, every year, every 2 years, or every 3 years?
Does anybody have any guess?
Every
6 months.
months.
I hear every 6 months. Anybody go for every year?
Every year, probably.
No,
Nope. How about every 2 years?
no,
Nope. How about every 3 years?
no.
Nope. Well, the correct answer is actually D, every 3 years.
Oh my gosh.
Yeah. So if you don't have any symptoms and you're overweight or obese between 35 and 70 years of age, you really only need to get screened for diabetes once every 3 years. Now, if you have what you think are symptoms of diabetes, then you should get checked. But if you don't have any symptoms, it's every 3 years. But of course, this is an estimate. So if you and your care provider think you should get screened more often, maybe you've got family members with diabetes, or you're not exercising very much and you've got a lot of extra weight, maybe they'll do it more often. But the recommendation based on the best evidence is only every 3 years. Do you have any
What if you're
questions about that? What's
So
that?
what about our friends over 70 years old?
Over 70. Okay. That I'm going to have to also look up too, because each screening guideline has specific criteria in terms of age and things like that. Let's see. And after 70, either it's not listed in the guideline, meaning they probably didn't do studies on it, or so I will look that one up too. Good question. What about over 70? Yeah, because there's over 100 different U.S. Preventive Services Task Force guidelines, and they're constantly being updated. So over 70, I'm going to have to look that one up. But
I have mine done when I go for my physical.
You have yours done when you what?
I have my physical every year
okay,
because I'm borderline, so he makes sure that I haven't went over
yeah.
into it, but I'm still borderline. So he just checks it every year when I have my physical for the year.
And that's probably really important, because this one is about screening. So it only is every 3 years if you have normal blood glucose usually. But if yours is a little bit high, borderline, then the every 3 years doesn't apply. So it's only every 3 years for somebody that has a normal blood sugar level. Then it would be every 3 years. But if yours is a little high, then they'll check it more often.
So does that mean if you've ever had it go a little bit high, like in the prediabetes level, or is it more open for judgment? And if you haven't had it in 2 years, then they don't do it again. Then they go to the every 3 years.
Well, and these recommendations are sort of like guidelines for physicians to follow. But then they have to make individual judgments. So, and again, these are for people that are without any signs or symptoms. So if you've had a little bit of a high blood sugar one time, they may be a little bit more cautious. But if it's somebody that doesn't have any elevated blood sugar, then they'd only need to do it every 3 years.
Well,
Okay.
he said this year, I'm going to do it again, and if it's all right, I'm going to let it go for 3 years. And I
Oh,
said, okay. And he did let it go for 3. I'm going to have it for 3 years this time. So,
well, then he's following the guideline. That's cool. Now, the next question also pertains to that. So that was the recommendations for how often, but this question's about Medicare and whether Medicare pays for it. So Medicare covers lab test screenings for diabetes. And I'm going to try to, if your doctor determines that you're at risk for developing diabetes, if so, how often will Medicare cover or pay for the screening tests? So once a year, 2 times a year, every other year?
Probably A, 1 time a year.
I say A
Okay.
too. A.
A? Anybody else?
it covers mine too.
A. All right, sounds like everybody says A. In this case, the answer is B. Medicare will actually pay for 2 lab tests for diabetes per year. And that's because Medicare likes to, even though there are recommendations, and Medicare wants doctors to follow the recommendations, there are sometimes people have exceptions, like, you know, if you're borderline, maybe you need to be checked more often. So Medicare pays for more than what the task force recommends should be done. So they'll actually pay for 2 screenings per year for diabetes. All right, so this is more open-ended question. I want your answers. So what are some of the risk factors for type 2 diabetes?
Possibly a stroke or a heart attack.
A stroke or heart attack, you're right. If you've had a history of a stroke or heart attack, it actually puts you at risk of diabetes.
Didn't know
it's
that.
the opposite's also true. Diabetes can put you at higher risk for other problems, but having a history of a heart disease or stroke can put you at increased risk for diabetes. What are some other risk factors for diabetes?
Obesity.
Obesity. That's true. What else?
Extremely thirsty.
That sounds like a symptom of diabetes, like something you might notice. So by risk factors, it's what are the things that make it possible or that increase the chance that you'll get diabetes?
Too little exercise.
Too little exercise is a really big one. There was a study in another country that showed that people that had type 2 diabetes, if they lost weight and exercised, they could actually get rid of their type 2 diabetes. In not all cases, but in some cases. So being physically active can prevent type 2 diabetes in many cases. In some cases, it can even reverse your diabetes and get rid of it. So any other risk factors that you can think of?
It can cause you to have eye problems.
Diabetes can definitely cause you to have eye problems. That's very true.
Too many starches and sweets.
What's that?
Eating too many starches and sweets.
It could affect your kidneys maybe and cause you to have to do dialysis.
It can definitely cause you to, diabetes can cause kidney disease. But I want to get back to the point about eating too many sweets and like starches. that actually doesn't put you at increased risk of type 2 diabetes. Unless, of course, you're eating so many that you're overweight or obese. So if you have extra body fat, maybe you're eating too many sweets, and as a result, you're overweight, that puts you at risk. But just eating the sweets and the starches doesn't necessarily put you at higher risk of diabetes, but being overweight does.
That's interesting.
Good.
It's quite the situation there. You know,
Yeah.
having to, so somebody who is thin and eats a lot of sugar may not have diabetes then.
May not be
Doesn't
at
mean
higher
it doesn't mean the
risk.
sugar is good for them, but
That's right, because there are other health problems. You know, if you're eating lots of sugar and you're not eating healthy foods, you may be deficient in minerals and vitamins and amino acids and things that could cause other health problems, but it doesn't necessarily put you at higher risk of type 2 diabetes. And there are some other things that put you at higher risk. One is if you're 45 years or older, if you have a family history of diabetes, and then a bunch of either African American, Alaskan Native, American Indian, Asian American, Hispanic or Latino, Native Hawaiian, or Pacific Islander. So almost any racial ethnic group other than white is a higher risk for type 2 diabetes. And having high blood pressure, having a low level of HDL, that good cholesterol. So if you don't have enough of the good cholesterol, it puts you at risk. Or if you have a high level of triglycerides, that type of fat in your blood, that can increase your risk. If you
so I'll just put a little commercial in here. One of the ways, so if your HDL is too low, it's a risk factor for diabetes. And one of the things that raises your HDL, which is your good cholesterol, is exercise. So I'm going to put a little plug in there again for exercise. Regardless of how you do it, keep moving because it's good for you.
And there's a whole program, and Chatham County had it, called Exercise is Medicine. Exercise is one of the most important things you can do for your health. It helps prevent all sorts of chronic conditions, and it helps prevent dementia. And so exercise really is medicine. Being active, even if it's out gardening or walking or whatever you do, it can be much healthier for you. So, and then if you've had a history of diabetes during pregnancy, or even had a baby weighing more than 9 pounds or more, and having depression, which is kind of shocking to me. I don't exactly know how that ties in with it. And so those are some things that put people at risk for diabetes, type 2 diabetes. But Jackie's right. Exercising and maintaining a healthy weight are two of the most important ways that you can try to prevent diabetes. What's that?
Want me to cook you some supper? No.
Oh,
Okay.
all right, so I'm going to move to the next question. Okay, so this one's also about diabetes. So people who have been diagnosed with diabetes and on Medicare can get self-management or self-care training if your doctor or nurse practitioner orders it. So if you have diabetes, how much training can you get in the first year you are diagnosed with diabetes? 20 hours, 5 hours, or 10 hours? So how much training can you get in the first year you get diabetes? You're diagnosed.
Any guesses?
Probably 20 hours.
20 hours, okay.
See,
I heard
All right,
it was
Conway saying B,
B.
5 hours.
no,
5
I
hours.
said C.
Oh, C, I'm sorry.
C, 10 hours. Anybody else?
Any other guesses?
Well, Conway, you're right. 10 hours. So the first year you're diagnosed with diabetes, you can get 10 hours of training. And that's 1 hour where you get it individually with a person one-on-one. and then 9 hours of group training. And so they teach you how to cope with and take care of your diabetes, such as eating healthy, checking your blood sugar, taking your medicines, and reducing your risks by being active. So, and some people may also be qualified to get special nutrition training from a dietitian.
And I'll just put another little advertisement in here. There's a lot of questions on diabetes, and you guys have got a lot of good information that you already know. But just so that you're aware, just make sure that you participate with us. It's always on the second Wednesday of the month. We have a diabetes discussion group where we have experts that we've been doing it over the phone, over Zoom. And we do it in person when we're able to in the centers. And this past week, we did nutritious and delicious desserts. So we focus on different things. Sometimes it's the prevention. Sometimes it's the what can we have that's good for us. So just food for thought to join us for that, because it's really important, because we have a lot of people in our community that are affected by diabetes and the side effects that come because of it.
Yeah, there are a lot of problems, and the more you can do to take care of yourself, the healthier and better you'll feel. So, all right, and there's another diabetes question. So you can get let's see, let's move to the next one. That was the answer for the first one, which was 10 hours of training. And then, so after the first year with diabetes, how much training can you get? How much training is covered by Medicare after the first year? A is 2 hours, B is 5 hours per year, and C is 8 hours per year.
Any guesses?
Probably A.
A is 2 hours. Okay, anybody else?
B.
Maybe B.
B5. Anyone else? All right, well, the correct answer is A, 2 hours per year. So you can get training, and I know that in Siler City, there's a diabetes educator at Chatham Hospital. It's a great clinic there. So in addition to what Jackie's groups are doing at the Council on Aging, you can, if your doctor orders that you get more training, you can go 2 hours per year. And I think that is like a group training. So if you feel like you still have some questions and need help with taking care of your diabetes, you can get up to 2 hours per year of additional training. Has anybody gone for that?
Actually, I didn't know it. So
Didn't know it. Well, if you need it, you can ask your doctor if you think you need more training.
And that's part of the reason why we do this, is to make sure that people know what they're able to ask their doctors for, because sometimes the doctors think you got it when you could use a little extra help. So
Right.
Ask away. They can only say no.
And sometimes we hear advertisements on TV that aren't necessarily accurate. And like the United States and New Zealand, I think, are the only two countries in the world where pharmaceutical companies are allowed to advertise to people. And so we've got
I did not know that.
In other countries, when we have students that come from other countries, they're shocked that we have advertisements for medicines here. It's illegal in most countries in the world. So here we have lots of companies advertising to try to get you to do things. And so we're trying to focus on the things that you should be doing, because there's a lot of people trying to tell you what's the right thing to do. And a lot of times it's not exactly correct. So.
The one in that line that really bothers me is there's a company that advertises for like a nutritional supplement that you can take that's supposed to help your brain.
Yeah.
And there is no evidence at all that says that those work. And they put these people on and say, oh, I've been taking this for 6 or 8 years
Yeah.
and I feel like I have better clarity of mind. And
Yeah.
they're spending a lot of money a month for this stuff.
Yeah,
And I'll
hear-
tell you, the only thing that they have proven that helps your brain is exercise.
That's right. Exercise helps your brain, and being social. So by
Yep.
coming on and talking to people, being social, exercise, and then avoiding things that are kind of poisonous for your brain. So it's important to, pay attention to what goes in your body. Yep. But exercise is good for everything, pretty much everything. Okay, so now we're changing subjects to glaucoma. And this is one I think is when I read the information about glaucoma, I'm pretty surprised because it doesn't follow what I would think is true.
Now,
So-
which one is that? Is that the one that gets the film over the eye, or is that the narrowing one? I get those confused.
The film over the eye is cataract.
Okay.
And glaucoma is extra pressure in your eyes. And I want to mention with cataracts, you can help prevent cataracts by wearing sunglasses.
Oh, wow.
So, sun exposure can cause or contribute to cataracts and what's that degenerative eye disease? I'm blanking on the name. It'll come back.
I'm working on it too. We're working in the brain.
Yeah.
Trying to get the,
Yeah, there's that one eye disease, and sunglasses can help.
Macular degeneration?
That's it, macular degeneration.
way to
So
go, Daryl.
if you wear sunglasses outside, you can help protect your eyes from cataracts and macular degeneration. But this is glaucoma, the one with pressure. So if you go for an eye checkup, sometimes they do that puff of air, or they put those things close to your eyes to measure the pressure in your eye to see if you have glaucoma. So Medicare does pay for glaucoma tests once a year for people at high risk for glaucoma. So what factors for glaucoma does Medicare consider to be important? So does Medicare consider diabetes to be important? Yes or no?
Yes.
Yes.
Yes, correct. So diabetes can put you at a higher risk of glaucoma. So Medicare will pay for a glaucoma test if you have diabetes. What about if you don't wear sunglasses outside? Is that a risk factor?
Yes.
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 I'll say
Well,
no.
the funny thing is it's not for glaucoma, but it is for cataracts and macular degeneration. So, or at least from Medicare's standpoint of what they consider at risk, not wearing sunglasses does not put you at risk for glaucoma. How about a family history of glaucoma?
I say
Yeah.
Yes.
Yes.
Yep.
yes.
That's correct. What about smoking?
Yes.
Oh, gosh.
I hear yes. Everybody say yes. Now, the funny thing, the kind of strange thing on this is smoking does put you at higher risk for glaucoma, but Medicare doesn't recognize that as a risk factor. They only have like 4 risk factors in their list that they count, but smoking really does put you at increased risk. What about being African American and 50 years or older?
Yes.
Yes.
Yes, that's true. So African Americans that are 50 years and older puts you an increased risk for glaucoma, and Medicare will pay for that test once a year. And what about Hispanic American and 65 years or older?
Yes.
Yes.
Probably yes.
Yes.
You're right. Okay, yes. And
We've got some smarty pants here.
We do.
She
So
gave
those
us
are
the
the-
answer. She gave us the answer. She
Yay.
said there were 4. We'd
What's
already
that?
done 2. You gave us the answer. You said there were 4. We'd already done 2.
Well, and there's a,
And
yeah,
then
that's
talk
true.
about
Oh,
Americans and Hispanics.
well, and there's another whole list of risk factors too. So some of the other risk factors are being Asian, having heart disease, high blood pressure, or sickle cell anemia, being nearsighted or farsighted, which is a lot of people, having had an eye surgery, eye injury, or certain types of eye surgery, taking corticosteroid medications, especially eye drops for a long period of time. And it also, some exposure, exposure to the sun might play a factor. But does anybody know what kinds of things can reduce your risk for glaucoma? Because there are 4 things that I know of that can reduce your chance of getting glaucoma.
What about your
Maintain a
diet?
healthy weight.
Maintain a healthy weight's one of them. Yay, Jackie.
Woo-hoo!
Okay. Woo! What's another one? We've heard this
Would your
word
diet
a
have?
lot today. What's that?
Would your diet have anything to do with it?
I heard exercise, but the what?
Diet. She asked
Diet.
if diet would have anything to do with it.
Diet does, and there's one specific thing. So what kind of healthy food do you think is really important to prevent glaucoma?
Carrots.
That's what I was thinking.
Carrots is really logical. That's a good guess, but it's not the right answer, but it's probably certainly good for you because it has what vitamin? What vitamin is in carrots?
A.
A, right. Okay, so okay, we've got the healthy weight, we've got exercise, and so what kind of healthy food do you think can help reduce the risk of glaucoma? Think of that rainbow of colors. What's a nice bright color of food besides
Probably-
orange?
Probably yellow or orange.
How about green?
Beets.
How about green? So what kind of green food do you think is it's gonna be green. So what kind of greens are good?
Spinach.
Leafy greens?
Turn,
Exactly. Spinach, green leafy vegetables. So if you eat lots of green leafy vegetables every day and you maintain a healthy weight and you exercise, you're going to help reduce your risk of glaucoma. And of course, if you don't smoke. So there are things that you can do. And then there's a 4th one, which to me is just kind of shocking. It has to do with your teeth. So what do you think you can do with your teeth to prevent glaucoma?
Would cavities cause it?
Close. What do we hear about? So when you brush in your mouth, what do you brush? You brush your teeth and what else?
And your gums.
Your gums.
Gums.
So if you keep your teeth clean and reduce gum disease, keep your gums healthy, it can reduce your chance of glaucoma. I don't know why, but it can help. So there's some interesting things. All right, now, so again, this is the answers then. So persons with diabetes, history of glaucoma, African Americans 50 years and older, Hispanic Americans 65 years and older, and then those other things. All right, and I've got the list here of the risk factors and reducing risk by eating lots of green leafy vegetables, keeping your teeth clean to reduce gum disease, being active and maintaining a healthy body weight.
Let me just share
Okay.
something here that to me has made a huge difference in my oral health.
Okay.
And my teeth were always really close together, so I had trouble. I couldn't
Me too.
floss. And one of the things that I found were what we call the little plackers, and they're the little, yes, and they've got plastic on them, but, and I know Julie doesn't like things that are plastic that are disposable. I understand
Yep.
that, but I'll tell you that the plackers, which is like dental floss on this little holder, has made it so my teeth are actually cleaner than they ever have been because I floss with them all the time.
Well, you know, Jackie, you can get them that are like that you wrap on, that you don't throw it away. So it's like a little pronged thing, and you wrap the floss on it. So it works the same way, and it helps you do it. I think because my ex-husband is a dental professor with children. And so, and because I don't like that stuff, yeah, my daughter got, it's like a little thing similar, and you hold on to it and you put the floss in, and it's much easier. So you can find those.
Well, there you go.
Yeah.
I'll have to look for that just for you, Julie.
Thank you, Jackie. Every little bit helps.
That's right.
Okay, so now we're switching to something that maybe we don't even normally think about, abdominal aortic aneurysm. So does everybody know what an aneurysm is?
My guess is no.
Yes, I know what it is. It's a bulge in the aorta.
You do know. It's a
See, Daryl's my
ballooning or
smarty pants.
bulging or weak spot in the artery wall. And a lot of times we hear about people having a brain aneurysm that bursts and then it damages the brain. But also that artery in the abdominal aortic artery, that could also have a little weak spot or a balloon spot.
Yeah.
And so they can do what's called an ultrasound, kind of what they do during pregnancy. They look to see how the baby is. You can do an ultrasound to check that artery, the abdominal aortic artery. So this question is true or false. Men between the ages of 65 and 70 years of age who have never smoked should be screened one time for this abdominal aortic aneurysm using ultrasound. So one time for men who have never smoked. Yes, or true or false, or it depends.
Go ahead, Bonnie. You want to answer? Give us a guess.
Probably A, true.
Yep.
True?
All right. What about you, Daryl? What's your guess? True, false, or it depends?
Yes, true.
True. All right. Conway, you got a guess?
No.
Okay. All right.
So we got some trues, we got some falses, and the correct answer is C, it depends. So based on scientific evidence for men who have not ever smoked, the evidence doesn't show that there are great benefits, that the benefits don't outweigh the risks, but it's an individual decision. So each patient needs to talk with their doctor and talk about family history and other risk factors and what's really important. So you make a decision together with your doctor, but the evidence doesn't show that it's really beneficial if you've never smoked. And so the answer is it depends. Okay, but let's say the same situation, but the man has smoked. So men that have smoked, what happens then? Should this screening occur for men who have smoked? True, false, or yes, they should be screened, no, they shouldn't be, or it depends.
I would say
Who wants
yes.
to guess?
Yes,
I
it would
hear
be.
one yes,
I guess it would be
I
C.
say yes.
and I heard
Two
it
yeses,
depends,
3
and a
yeses.
yes. Any others? The answer here is true. So yes, the task force recommends one-time screening for this aneurysm for men who have smoked at some point in their life, and it gets a grade of B. So it's not the best evidence, but it's good evidence that if you've ever smoked and you're a man and you're 65 to 70 years of age, 75 years of age, you should get this screening one time. Now, what about women who have never smoked?
I was wondering whether we were going to get to the women on this one.
Women. Yeah, let's be fair and let's ask about women. So women who have never smoked, should they get this test or do they need it?
I'm going to say false.
False. Okay. Who else? Anybody?
I'll say false.
Do I false? Okay. I was gonna pick on people. Who else do I see here?
Let's see. What about true?
True.
Bonnie says true. Anybody else?
True.
True. All right. Well, for this one, for women, the answer is false. The task force recommends against getting screening for abdominal aortic aneurysm for women who have never smoked, and they've got a grade of D. So that means there really wasn't any evidence that the benefits of getting screened outweigh the risks. So women must just not have this problem as much as men. But what if they have smoked? I'm sorry,
Oh, well,
is there a
wait a minute.
question?
Bonnie's got a question.
Yeah.
They may not have a problem, but that's what my older sister had, and she lost her life with it.
Oh,
Wow.
I'm sorry. That's sad.
So Bonnie, that's where that statement was never
she
smoked
never
and had
smoked.
no family history. So
Yes.
you've got the family history.
That's true.
But she never smoked.
She didn't
Wow.
smoke? Did you have anyone else in the family that had it before?
No.
No. Well, then that was just, yeah, and these are not going to be 100% perfect, but these are the recommendations. So I'm so sorry about that. But
So
what
for your sake then, Bonnie, you should probably be screened. Would that be correct, Julie? Since she's got
Well-
family history?
Well, so then the women, so this question here is women who have ever smoked or have a family history. So that's what our next question is. So you have a family history of an abdominal aortic aneurysm. So with your family history, would you need that test? So the answer is yes, no, it depends, or there's not enough evidence. Any guesses here?
I'll say yes.
Okay, Louise votes for yes.
Yes.
Neria, what do you think?
I think, yes.
Okay, what about you, Bonnie?
It might be D, insufficient evidence.
That's possible.
All right.
Yeah.
Well, let's see. And the answer is, Bonnie, you're right, insufficient evidence. So that doesn't mean that it's good or bad. It just means that maybe there haven't been enough research studies and maybe they weren't good enough studies to know. So you're right. So women who have ever smoked or have a family history of this abdominal aortic aneurysm, we don't really know whether you should have it. But I guess if it were me and my sister had it, I would ask for the screening.
Yeah, I would too.
Because an ultrasound is not invasive. It doesn't hurt. So to me, it's like, okay, the risk is yes. The risks for something like that might be that they get a false positive. But if it were me, I would ask for the screening. If I had a family history of it, even though there's not enough evidence, that just generally means that often that they haven't done enough studies to really know. So, all right, any questions about this one?
I have to leave now.
Okay.
Well, we're
All right.
glad you were here, Bonnie.
Yeah, thanks for coming.
All right, we'll see you soon, Bonnie.
Take
Okay.
care. All right. Okay, now we're going to talk about smoking. So Medicare covers some services to help people quit smoking. And actually, they'll even cover face-to-face visits. So how many face-to-face visits with like a care provider, doctor or nurse practitioner or somebody does Medicare cover in a 12-month period to help people quit smoking? Is it up to 4 visits, up to 6, or up to 8?
6.
I hear 6. What else do we
8.
have? 8?
You got an opinion?
No.
Anybody? All right, let's see. Oh, the answer is up to 8 visits. So if you smoke, you can get up to 8 face-to-face visits with a care provider to help you quit smoking. And the task force recommends that care providers ask all adults about tobacco use and advise people to stop smoking. And for non-pregnant adults, provide behavioral interventions to help people stop smoking and those special medications to help stop smoking. So smoking causes so many health problems. So Medicare pays for up to 8 visits just focused on stopping smoking. Any questions about this?
I was thinking it was up to 8. I didn't say anything because my deceased husband smoked, and the doctor told him that smoking was a worse habit than crack cocaine. So it's hard to quit.
Yeah, it is really tough. I mean, I can't say I've done it, but yeah, I know people that have even done things like hypnotism to try to quit. It's probably really
My father tried that. He tried acupuncture. He tried a lot of things to quit smoking, and he ended up dying of COPD.
yeah.
Husband too.
And it's sad that companies start hooking kids on it early. So, yep. And the earlier they start, the harder it is to quit. So,
Yep.
So
He would
those
still
visits-
smoke as he was pulling. He would still smoke as he was pulling his oxygen tank around.
Oh,
Go figure. Yeah.
My dad smoked My dad smoked 1 cigarette a day at nighttime, and it bugged us. So for some reason, I found these like little tiny things. They look like toothpicks, and stuck them in the end of the cigarettes. And when he lit it, it kind of blew up, and he quit. And my siblings and I used to like sit in the living room at night if he'd have his 1 cigarette, and we just like cough really loudly, all of us, and we were really obnoxious. So he just said, I only need 1 a day to relax, and we didn't let him have it.
Wow. We used to ride around in the car in the winter with the windows up with my dad smoking in the car.
Ugh.
And I just remember just feeling like I was suffocating. It was horrible.
It is. All right, so we got a couple more questions here. I'm going to move to the next one. So this one might be an easy one. So true or false, it's recommended that all adults be screened for obesity. And if the person's found to be obese, then he or she should be referred to a program or service with different parts of it to help the person lose weight. True or false?
I want to say true, but it's probably false.
Anybody else? It might be tricky, may not be. What do we think? Miria, you look ready to answer.
They're talking about a whole lot of folk, including myself. I don't know, because the doctors talk to you about losing weight all the time.
Yeah.
Mm-hmm.
So should everybody be screened for obesity, all adults? And then if they are, be referred to a program with a whole bunch of components or parts to it?
I think that part is what throws it over the edge.
Yep. Well, let's see. The answer is true. And let's see if I have another slide. Yes, the answer is true that if somebody, doctors should screen everybody for body mass index, and if they're overweight or obese, they should be referred to programs. And not only that, so your doctor should be sending you to a program or setting you up with a program that has behavioral management to help you lose weight, set weight loss goals, work on improving your nutrition or diet, increase your physical activities, identify what kinds of things make it hard for you to change, and help you with strategies to maybe write down what you're eating, you know, sort of monitor how you're doing, and plan maintaining lifestyle changes. So they should probably be setting you up with a health coach to do this, or a nutritionist. So if you're overweight or obese, these are the things that should be happening.
And I'm going to put another little advertisement in here. So at the Council on Aging right now, we are offering a program called TOPS, which is Take Off Pounds Sensibly. We do it every Thursday at 1 o'clock. So it's kind of it's a group kind of support setup where we do education every week, some portion of education, some accountability, and we encourage each other. There is a charge for it because we have to pay it to the TOPS organization, but it's only like $32 a year, which is much cheaper than you would get any other weight management program. And we are looking for new people who might want to join it. You can let me or Liz know that you want to join, or Robin Lido, and the information has been on the calendars. And we do really encourage you to do it because it's a reasonable, I think it's a reasonable cost, and it's a reasonable way to implement change in your life to maybe help.
I have a question to ask you.
Yes, ma'am.
Is it going to be at the West Chatham Senior Center where they're going to be doing the exercise at?
We will be offering exercise at the Western Center, yes. I am, right now, I'm getting ready to do the pool class. We will be doing an aquatics class starting the middle of June. That'll meet on Mondays and Wednesdays at the, oh, what is the name of the park? I'm just drawing a blank. The Bray Park pool.
Park.
So, and it's going to be limited availability, and we're opening it up initially just to the people that normally come to the Western Center. We're going to be also doing an aquatics, and it's the arthritis class that we'll be also doing at the Pittsboro Center at the Pittsboro pool, and that will be Tuesdays and Fridays. And then we will be doing exercise in person at the Western Center once we get open. We're just not exactly sure what that looks like yet, Miss Brenda. So we're working on it.
I would like to join.
You want to do the pool class?
No, I don't want to do the pool class. I want to do the exercise class at West Chatham Senior Center in Silo City.
Okay. Well, we will be reaching out to people about that. So I'm going to write your name down that you're a potential participant for exercise at the Western Center. Thank you for letting me know that.
Okay.
All right. Only have 3 questions left. So this one, should doctors or other care providers screen the general adult population for depression? Yes or no, or there's not enough information?
Yes.
Yes.
Here, yes, yes.
Yes.
All right, yes. But there's a little kind of caveat. So let's say a care provider just decides to do depression screening, but maybe there aren't even any mental health services to refer people to if they have, if they find that they have depression or might have depression, then the answer is no. But so basically, before providers screen, they have to make sure that they've got a place to refer you to first before they do screening. Otherwise, it could be a bad thing. But the answer is yes, and it's important that they have systems in place or services to provide treatment and follow-up if needed. So, but yes, that should be done. Okay, so for women aged 30 to 65 years of age, how often should they be screened for cervical cancer? Every year, every 2 years, or every 3 years?
Every year.
Every year.
So we got a couple every year. Any other answers?
I
I
think
say
they may have
every year.
changed it to every 2 years.
They have definitely changed it because I think when I was young, it was every year. It is now every 3 years. And it gets, based on evidence, it got a grade of A. And that is really for people that are 30 to 65 years of age who, are not at increased risk. So if you're at increased risk, then it's going to be different. But if you're just normal risk, just every 3 years. But what about for women older than 65 years who had adequate screening before, before they turn 65? What grade is given to screening women 65 years of age or older after age 65? So getting screening, would it be cervical cancer screening, would it get a grade of A, B, C, D, or I? And A is the best, B is still recommend, but not as good. C is, kind of on the fence. Risks may not outweigh the benefits. D means don't give it. And I is not enough evidence or insufficient. So for cervical cancer screening for women 65 and older, or older than 65, what kind of grade would it get?
I say
You said A?
mm-hmm.
Anybody else?
You say D means don't do it?
D means don't do it. Mm-hmm.
I'm going to go with I.
Okay, we got an I. Neria, were you saying D?
Well,
just
I was thinking
thinking
about
about-
after you reach a certain age, you don't do the pap smear. So I'm trying to figure out how that's.
Well, and cervical cancer screening is the pap smear,
Right,
so.
I was saying D.
And I'll be 65 this year, so D. Okay, the answer is D. The task force
Look at that, Miss Neria.
recommends against screening for cervical cancer using that pap smear after the age of 65, and it got a grade of D. And that's if you're not at high risk and if you had adequate screening through the rest of your adult life. But if you're at higher risk, or maybe you weren't good at getting your screenings earlier, then you might need one. But if you kept up with screenings when you were younger and you're not at high risk, you generally are not going to need a cervical cancer screening after age 65. So I think that was the last question. Anybody have any questions for me? Not that I necessarily have the answers, but any questions?
So the question I have is, did anybody learn anything today that is going to make them more equipped to ask their doctors or providers about something you learned today? Okay.
Anybody? Did anybody get inspired to be more active today and join more of Jackie's or other activity classes?
I did.
Yes,
I did.
I did too.
Good.
I did. I think I'm gonna join the exercise class and thing. Do exercise more. Trying to prevent getting dementia. Cause my mother had it.
Oh, there you go.
That's
You know
fun.
what? And Brenda, I think that was you. My mother died with Alzheimer's disease. And I'll tell you that's probably the main reason I started exercising again on a regular basis. And I noticed such an improvement in my brain function as a result of increased exercise and just
Yeah.
increased ability to do everything. I'm like a different person than I was 10 years ago because of increased exercise. So I really do encourage everyone to do it. So I'm glad you're going to be joining us when we do exercise, Miss Brenda.
Yeah.
And please remind me of it, though. Please
Okay.
remind me. I want to join. I want to join the West Chatham Senior Center.
Okay. I've got your name down, Miss Brenda.
Yep.
All right, then, because I tried to listen about the mission thing because it runs in my family. I got cousin got it. My grandmother had it. My mother had it. My mother had sisters and brothers had it, and I got aunts and stuff had it too. It is. I mean, it's a bad disease to have.
So,
Very
just
bad.
just so you know, June is Alzheimer's and Brain Health Awareness Month, and I'm working on. We will be having a program that touches on it on the second Tuesday of June. I believe we're going to have another one on the first Thursday in June. So I'd love to have you join me for that because I think the more we're educated about dementia and Alzheimer's disease, the more we can be in control of the things that we can be in control of. But we have to know what we can do to make a difference.
Exactly.
Okay, I want to join that. And you forgot to call me today.
I did call you. For some reason, it didn't go through. So we may have to practice that. Some people, their home phone numbers, for some reason, they don't go through. And I apologize, but we'll have to figure that out, Miss Brenda. You were not forgotten. I
I have a
promise.
little problem with my phone too and stuff like that.
Okay. I personally called you, I think, 3 times this morning trying to get you in. So I know we tried.
Okay, then I said I didn't want to hear all I can about Alzheimer's and dementia and stuff. I do.
Okay.
Because that is something that I just don't want to have.
You and me both.
Neither. So takeaway message, be active as you can be. Get off the couch, walk around, move around. The more you do, the healthier you can be.
And be around people. Be
Mhm.
around people.
Yep.
So I think we need to call it quits. We are at 12:30. We have overachieved, but I think what we did was an amazing program. Thank you, Julie, for being here with us today.
You're welcome.
So appreciate it. And just so you know, let me think. Tomorrow we will have legal outreach with Melanie from Legal NC. So we hope you'll join us for that. There's always good things to learn about that. So we just hope you'll join us. And we thank Julie. Thank you so much, Julie, for being here. And love you all. Have a wonderful day, and we'll be in touch soon.
All right.
Take
Thanks
care.
for inviting me.
Bye.
All right. Bye-bye.